Hi, I'm Dr. Larson with this week's Monday Motivation from Thrive. This month we're talking about metabolism, and today I'm talking about a hormone that is involved in our metabolism that you may never have heard of called adiponectin. Adiponectin is primarily made in our fat cells or our adipocytes, and it is one of the most abundant hormones in our bloodstream. Studies have shown that people with high levels of adiponectin actually have decreased risk of obesity, diabetes, high blood pressure, and heart disease. Now, you may think this sounds kind of counterintuitive because adiponectin is made in fat cells and high levels of adiponectin are good for us, yet high levels of fat are not. This is because when we have excess fat cells in our body, excess fat, particularly abdominal fat or visceral fat, the fat cells don't function normally. They've been called sick fat. Sick fat cells don't function normally, so they don't produce as much adiponectin, and they do produce more inflammatory chemicals that increase our risk of diabetes, high blood pressure, heart disease, and other diseases. We also know that the distribution of our fat cells is important. So people who have higher upper body fat as opposed to lower body fat have lower levels of adiponectin. And women have higher levels of adiponectin than men do. So that goes with the age-old idea that the apple distribution of body fat as opposed to the pear is linked to increased risk of diseases. So we know adiponectin is good for us. We don't really know exactly all the reasons why, but we do know that adiponectin increases our insulin sensitivity. So that decreases our insulin levels and improves our blood sugars and decreases risk of diabetes. Adiponectin also has an antioxidant effect, which decreases disease risk. And it has an effect particularly on the arterial walls where it decreases inflammation and is anti-atherogenic. So it decreases risk of plaque formation and heart disease. So we know it's good for us. Now we got to figure out how do we get it higher. Unfortunately, no drug company has figured out how to put it in a pill or in a shot. Like pretty much everything else with our health, there's not a quick fix. It takes long-term changes, in particular with our lifestyle. We know that decreasing weight leads to elevated adiponectin levels, and also so does physical activity or physical fitness, even without a weight change. So our daily choices on our lifestyle make a big difference. So if you're trying to improve your health, or you need to lose some weight or make some changes, just remember when you're deciding what to eat that day or whether or not to go to the gym that day, that what you're going to do may actually improve your adiponectin levels. And on a day-to-day basis, long term, you'll be improving your risk or decreasing your risk of chronic diseases.